Doctors David and Laurie Scotton had long dreamed of a veterinary clinic and animal hospital that would meet all their needs, a place that was spacious and functional so they could serve all their clients efficiently, a place that was warm, inviting, and animal-friendly on the inside, while aesthetically pleasing and residential-looking on the outside. In essence, the Scottons required an animal hospital that brought together the best of all worlds, and they fulfilled that dream with Morton Buildings.
There are some very fine veterinary clinics and buildings here in Greensboro, and we feel like ours is right up there with the very best. And that was our intention. And you know, with Morton, we were able to do that. So we're very pleased.
It's always a difficult decision when you're trying to decide who you want to build a building, and the reason that we were serious about Morton Buildings is because we felt we could get more building for the money. Morton has a tight design as far as the energy efficiency of the building, and we felt like that for our dollars that we could get the largest and the nicest hospital.
Morton Buildings works closely with you to create the veterinary facility that matches your unique requirements. Whether you're thinking of a small veterinary office or multi-ward complex with large kennels, pet runs, and surgical suites, Morton Buildings puts our 93 years of solid experience to work for you.
Our Morton sales consultant did a real nice job. As far as the design here in the hospital, I can't take any credit. My wife actually did every bit of it. But the exterior of the building, he did a lot of that, if not all of that. He took our ideas and he drew up what I think is a real attractive design. And like our porches, there's extra things on them, which was an extra expense, but it was minimal compared to the aesthetic beauty that it actually gave the building.
As you enter the hospital, you enter the reception area. This area is designed to be open so that our clients have a lot of space to move in, and we also have 2 separate seating areas so that we can separate dogs and cats or aggressive animals from animals that could potentially be harmed. We try to make this area bright and airy, and then we have a clear story in the top and a cathedral ceiling. And we also made it open so that our reception staff could see from one part of the room to the other so they could intervene if there was a potential dog fight that was going to start, or if they had a client that needed assistance, they can see what's going on with a minimal amount of movement. We have a mural on the wall that's supposed to make our clients feel at home and give us a pastoral scene. It's stressful when you come to the veterinarian, and we wanted to make a pleasing and calming environment. Behind our reception desk, we have a small business office that's used by our bookkeeper and also by the rest of the staff. There's an additional computer station there. We do have 2 computer workstations so that we can have 2 receptionists working at the same time, which is necessary during busy times of the day. On the far side of the reception area, there is a small retail area. We don't place a lot of emphasis on retail sales. We primarily try to concentrate on our medicine and surgery. And that area primarily has therapeutic foods and dietary aids. We have 3 exam rooms that come off the reception area. They're all different sizes, and we design each one with a particular purpose in mind, although they're very interchangeable with each other. The exam room that is to the far left as you're facing the rest of the hospital is our big dog room. It has an exterior window in that room, and it's the largest of all the exam rooms, and has enough floor space that we can do examinations on big dogs on the floor. And we particularly like to do that. We rarely pick up the big dogs, that we feel they're more comfortable when they're down. The middle room is the smallest of our exam rooms, and it's designed to be a room for cats or other small animals. The room that is closest to the hall is our intermediate size room, and we do medium-sized dogs and cats in that room. And again, they all have very similar equipment. You'll notice that we use stainless steel tables so that they're easy to disinfect. The walls are painted instead of wallpapered, and the paint is designed to be scrubbed, which is very helpful. And it's easy to disinfect very quickly in between exams, but yet has an open, spacious feeling to it. As you pass out of the exam rooms, you actually step into the central core of the hospital, which is our treatment area. And this is a very open space, which differs, I think, from a lot of traditional hospital designs. A lot of traditional hospitals, you would step into a corridor that would be a pharmacy corridor at that point. But we really like to keep an eye on our patients, and we wanted to be able to have a small amount of staffing and still be able to know what's going on and to help someone when they needed help. So we made that space very open, so you can actually see when you step out of the exam room all the way to the door of surgery, and you can see the intensive care cages in the background. The first area that you come to is our laboratory area, which is to the right. This is meant as to be made as an alcove so that when you're in the laboratory area and you're working at a microscope, you won't get bumped or jostled as someone comes by. We have one standing microscope station and one sitting microscope station, and there's also a sink in the corner there and plenty of countertop space for whatever laboratory procedures we're doing that afternoon. This countertop to the left is our pharmacy countertop. We have a computer station there, and since we have an integrated computer system, our prescriptions are filled there, and we have to store our injectable drugs on the wall at that point, our pill bottles, that sort of thing. As you move further into the treatment room, the dominant feature in the room is our treatment island. The moving end of the treatment island is actually a gurney with the same countertop as the fixed end, and we induce anesthesia there, clip and prep our patients for surgery, and then we can use that gurney to move into the surgery room or into the radiology room if we have a very large patient that we don't want to pick up and down again. The fixed end is basically a countertop with cabinets underneath. That's our treatment island that we do all of our inpatient exams, any treatments that are being done on inpatient animals that are having medications, that sort of thing. That's what that end of the table is used for. Just behind the treatment island is a bank of ICU cages, and we use those for the most critical patients that are in the hospital, and particularly anybody that has had surgery that day will be in ICU until we feel that they're stable enough to move to another area. To the right, our ICU cages, we have an oxygen intensive care cage, which we're very happy about. It makes it easy and low stress for the animals to receive oxygen, and it lets us keep a close tab on those patients that need us the most. You'll notice as you look around the room that there are green lines hanging down. Those are the in-house O2 lines. We have our oxygen tanks actually outside the building, and our oxygen is piped through the building. And we also have clear tubing hanging down, and that's our active scavenging system, so we can make a safe environment for our employees. As you look to your left, the first door is our radiology room. This room is lead lined so that anyone that's outside of the room when we're taking radiographs gets no radiographic exposure. Inside the room we have a lead lined shield so we can have a third assistant in the room that can actually develop the film for us or shoot the film for us while two people are restraining. The next room that adjoins our radiograph room is our surgery suite. The surgery suite is large enough to accommodate 2 surgeons and to have 2 sterile fields operating at the same time with no cross-contamination of fluids or blood between patients. We have a cabinet that is made into the wall that opens into the room and also outside the room so that an assistant can get us additional materials without stepping out of the room and hopefully not causing a draft as they're going in and out of the doors. This room is also positively pressured so that, again, we have no drafts in surgery. As you leave surgery, to our left is our pack prep area. We had a set of specially designed cabinets that has an exceptionally long work surface there to handle the large drape material that we need to use when we're preparing surgical packs. And we also have a washer and dryer in this area and our autoclave so that we can steam sterilize our instruments. We have a small closet for storage space in this area. As you pass by the ICU cages, the next alcove to the left is our dental area. This area is actually a freestanding surgical suite for dirty surgeries. Dirty surgeries are things like treatments of wounds or opening abscesses on animals or dental procedures. In dentistry and veterinary medicine, our patients are under anesthesia and they're not able to spit the fluid out whenever you put it in their mouth. So the table has a grate top so that all the fluids, the waste fluids, go through the tabletop and into the piping system underneath. Again, you'll notice the same anesthesia hookups and gas scavenging system hanging from the ceiling, and we have a set of cabinets to store all the dental surgery instruments. We also keep a small incubator in this area that we use for neonates whenever we've had a C-section or another procedure done on a very small puppy or kitten, and a set of x-ray viewers so we can look at dental films in this area.